Hey, Jackie.
Hello.
Hey, Jerry. Carlo.
Hi. Hi, everyone.
Hello,
Hey, Kevin.
everybody.
Hello.
Hi, Dave.
Hi.
Here I am. Sorry about that. Let me just get this started. Hi, everybody.
Hey, Carrie.
Hi.
How are you? Hi,
Good.
Carlo. Nice to see you. Are you feeling better, Carlo? Is the shoulder a little easier?
Thanks for asking. Yeah, it's a long road, but
Yeah.
a little over 2 months in, and it's getting better.
Patience
Hi, everybody.
and sympathy. Sorry.
Paula.
Hi, Carlo.
Sorry for the delay. I couldn't find the ID for some reason.
Mhm.
I just got here, Paula. You just made me look good. That's all.
How is everybody?
Good.
Good?
Yeah.
Good.
Great job the other night, Ade.
Thank you.
Yeah,
Yeah,
nice
great
to-
job.
Yes.
I guess we can rock and roll here with everybody, right?
Me too.
All right, so let's call the meeting to order. I know everybody's anxious to get to the 9 o'clock Celtics game, so I don't think we'll be going over 9 o'clock. We may not even be going over 8 o'clock. Who knows? So tonight's agenda, we're going to approve the minutes. As usual, we have 3 items that Ade is bringing forward, which one around the YMCA and operating a recreational camp, follow up on Hartshorn Street that we talked about last time, and then follow up on the body art apprenticeship program that was sent to everybody today after town council review. Kevin will give us a brief update on the coalition, if there is one. We'll have the monthly report. Public health support grant, guess further discussion on spending that money, public comment, and we'll wrap up. So that's the plan for tonight. Starting with the minutes, any comments or concerns about the minutes? I actually have one small suggestion or edit, and that is that I think Kevin arrived around 7:20, 7:25, and probably would make sense for accuracy purposes just to note that
Yep, correct.
on the attendees component, just for the record.
Yep.
Other than that, it looked good to me. Any concerns? Carrie, looks good to you?
That looked good to me. Thank you, Jackie.
Minutes, yeah. Okay. Make a motion to approve the minutes from May 19th. Do I have a second?
Second.
Second. Roll call. Paula?
I wasn't there, so
Okay.
That's right, you weren't there, so you're abstaining. Carrie?
Yes.
Yes, and Rick, yes. That's right, Paula. All right. So I'll turn it over to you, Ade, for the YMCA discussion.
All right. Thank you very much, Dr. Lopez. I will try to make this as quickly as possible because I know that people are trying to watch the game tonight. So,
Mhm.
all right. YMCA. The YMCA is requesting permission from the Board of Health to operate a recreational camp without prior inspection. They've done this in the past, but typically the health director or the health agent will just sign it and let that occur. But based on the regulation, the Board of Health actually has to look at it and take a vote to either approve it or deny it. So, they're requesting this permission because they serve students that use vouchers as a means of payment, and the state will not allow the YMCA to register these students until a recreational camp permit has been issued. Sorry about that. Now, based on the regulation 105 CMR 430, the minimum standards for recreational camps for children, there is a provision in there for the local boards of health to grant a license without prior inspection if the camp is under the same ownership and directorship as the previous camping season, 1. 2, if the camp has had a satisfactory inspection report the prior camping season, so that will be 2021 camping season. 3, if the Board of Health determines based upon the record of the camp that there is no evident risk to the health and safety of the campers. And 4, if the camp is subsequently inspected by the Board of Health during the camping season, which will be 2022 camping season. So basically what we did, we looked into the records of YMCA, and I forgot to mention that they really wanted to show up, but they couldn't make it because they had a company retreat, something like that. So they were not able to make it to this meeting. So I told them I was going to present to the board on their behalf and let them know the outcome. So basically what we did, we went through the records, previous years, and it appears that YMCA meets all the requirements as stated. And I would like to recommend the board grant a license without prior inspection to YMCA, with the understanding that the camp will be subsequently inspected during the 2022 camping season. And as a matter of fact, we scheduled the inspection for June 27th, and that will be right before the camp begins. So, all you're doing is giving them the permission to be able to register these students because it's a state requirement. And that's pretty much it.
Ade,
Yes.
do I recall correctly that they did the same thing last year?
They've been doing this from year to year, but
From a year, yeah,
but
that was
the
my recollection.
director has been signing, just signing the document without coming to the board.
Mhm.
But based on the regulation, the Board of Health is supposed to make that determination and vote to approve or deny it.
Great.
So that's where we're at the moment.
Okay.
Thanks, Ade. And my concern, and thanks for, you answered all my questions. My concern was about when we would be inspecting and about, I know the staffing changes from year to year, and of course that makes it challenging. I think the Y runs a good program, but it changes. So, but thanks, you answered all my questions, so.
Yeah, it seems like if they meet all the requirements under the state statutes, then I certainly don't have a problem with it. So I'd make a motion that we approve the early permitting of the YMCA camp as requested.
Second,
Roll call, Carrie,
Yes.
Paula,
yes.
Rick, yes. We're all set. Thank you.
Very much. All right, the next item on the agenda is 34 Hatchon. So pretty much at the last meeting, the Board of Health granted a variance request to modify the compliance time. So I'm just giving you an update because we conducted a follow-up site visit on Thursday, May 27th. Jennifer did that for us. She observed that the dumpster was full to the brim, and most of the cleanup had been completed in the backyard and throughout the entire premises. At this point, it appears that the owners are being responsive. I'm very optimistic that the violations will be abated during the modified compliance time period. And, I'll let Jennifer talk about what she observed during her inspection.
Good evening. So I went out there on the 27th. I did a walk with both of the owners. This time we did a full, I was there for quite some time. Everything that's noted that needed to be corrected, for instance, the fence, the parts that were coming down were removed. The rest is structurally stable. So I said it was okay to stay. They've just had moved piles of bricks. They got rid of some. Things are just in a much nicer and organized shape. They're going to be taking down the shed. So everything has been out of the shed where there was some activity back there, but more wildlife activity, not rat activity. They've been very compliant. I'm working with them as best as I can, and they're doing a fantastic job. I do have my next site visit with them on the 21st. As the day said, the dumpster is full. So they were going to see what they could do with it, if they could dump it early, if they could redo it. But they're doing a fantastic job over there. They get things moving.
Thank you, Jennifer. So our next scheduled inspection will be June 21st. And, as I said earlier, we're very optimistic that the violations will be completely abated at that point in time. And we will update the board at the July meeting. Thank you very much.
Good to hear.
Yes, thank you, Jen.
Body art.
Right, that's the big one.
Hmm.
Okay. All right, body art. At the last meeting, we talked about, amending the body art regulation to include an apprenticeship program. We came up with a draft. I sent a draft to town council for legal review. And, they came back with some suggestions, recommendations, feedback, whatever you want to call it. I would like to pretty much dissect the town council's feedback, and hopefully the board can make a decision tonight, or whatever the board decides. So pretty much, initially we had a one-time fee of $250 associated with the 2-year duration of the program. Based on feedback we got from town council, that format violates the requirements of section 22, which is our fee schedule. So our fee schedule, section 22, requires that licenses be annual and expire on the last day of each calendar year, which is December 31st. So instead of one $250 fee for 2 years, that was amended to $125 fee per year for 2 years. So we will go ahead and list that on section 22. Once this amendment has been approved, it will be listed on our fee schedule as $125 per year for 2 years. Town council also pointed out that we didn't have the definition of apprentice in our original draft. That has since been corrected. Town council didn't think notarization of timesheets should be included. That has been removed. Town council also thought it would be prudent to reconsider the complete reset if there's a 30-day break in training. So the original draft if there was a 30-day break in training, automatically the apprentice has to start over. But town council did not really agree with that. They thought people might have different reasons for taking a break, and that could be particularly problematic if the apprentice needed to take a break because of a medical issue while they're about to finish the program. So these pretty much what the town council suggested was that we give the apprentice the opportunity to come back to the board and explain why they were out for 30 days or more, and if it made sense for the board to have them continue the program, the board will let them continue. And if the board decides they have to restart the program, then they will restart. So that language has been amended and included in the new draft that was submitted to the Board of Health. Other recommendations by town council includes requiring the licensed practitioner to secure insurance for the apprentice. So if something goes wrong and the apprentice does, makes a mistake, something like that, there is some kind of insurance to cover the apprentice and cover the business and cover the customer. They also suggested that we increase the number of apprenticeship hours from 1,800 to 2,400. It appears that 1,800, may be insufficient, and 2,400, is not out of line if we go with 2,400, and that should be adequate. So they're proposing we go from 1,800 apprenticeship hours to 2,400 apprenticeship hours. Let's see. Also, they made this recommendation to potentially break down the training hours into various categories. So for example, we can say, let's see, 2,200 hours for body art, performing body art, and then 200 hours for sanitation, things like that. They think that we would have a well-rounded apprentice if we do that. They also believe that we should limit the number of apprenticeships that a body art practitioner can supervise at once. Currently, in the draft that we have, I don't think we have any language stating that. So this will be up to the board if we should include the recommendations or not.
So why don't we take this in sort of two chunks. One is, the first, the recommendations or revisions that they actually incorporated into the draft, which were separating the fee to $125 each year for 2 years, putting in a definition of the apprentice, and having the board have the option to, or having the apprentice have the option to come into the board if there's greater than a 30-degree break in training. Those were incorporated in the draft that the town council returned. So let's sort of just briefly consider those, and then we'll do the other issues that Ade mentioned. From my perspective, all those things seem fine. I don't really have any issues with those changes. Does anybody have any concerns? I see a lot of shaking heads, but no.
Concerns.
Yep, seems good.
The second chunk is, I don't know whether they were making recommendations or they were sort of raising issues. And so we should go through those maybe one by one and just see what people think. So the first one was, does the board want to want the licensed practitioner to have insurance for the apprentice. And what I don't know is whether we require insurance for body art facilities, or in terms of licensing the practitioner, are they required to have insurance? I did go through section 23 of the health regulations, and I didn't see any reference to, I might have missed it, but I didn't see any reference to insurance. You know, I know as a physician, in order to get your license, you have to have malpractice insurance. Just like, you know, if you own a car, you have to have auto insurance. I mean, it makes sense. My only question is, would it make sense to require this of an apprentice through their mentor, if in fact the mentor doesn't have it? So I just don't know how that works. A day, yes.
So the way I see it is just for liability purposes. So for example, if an apprentice makes a mistake and the body establishment gets sued, you know, they have some type of insurance to take care of the problem. And then they can say that, well, the health department gave them a license to, you know, practice, to have their apprenticeship program. So maybe we should go after the health department. So the way I see it is, if we require it, that would pretty much cover us as well.
Mhm.
So currently, I mean, my point is that, do we mandate insurance for the body art business and the body art practitioner currently? Do we do that currently for those two? Because if we did, then it would make sense to do it for the apprentice as well. But I don't know. Do you know if we currently require that?
So we don't, but if you're opening up a business, you have to have the insurance.
I would think so.
So they have insurance for the business, but we, as the you know, health department, board of health, we don't mandate that.
Maybe we should ask Courtney Ryan. They had their hands up, but maybe they can answer that question.
Right, it would be, does their policy cover their apprentices, you know, or what are
Yes,
the terms of
already
the
covers.
policy? Yeah,
So I was required to get $1 million liability insurance to open the business, but Courtney's not going to be working on anybody. It's not going to matter until she actually has her practitioner's license. She's not going to be working on the public. She'll be working on her friends and a small group of people. She's only going to be learning until she can get her license. Then she will be covered on like everybody else would be covered under my liability insurance.
So currently, an apprentice would not be covered under your liability insurance.
An apprentice doesn't even touch any. No, apprentice wouldn't be covered. And when she's licensed, then she'll start tattooing the public. Then she'll be covered under mine.
so what are the procedures if she's practicing on someone, and do people sign some sort of waiver or agreement that,
So right
you know,
now-
they know she's practicing as a student?
So the way we teach her until she's ready to tattoo flesh is we use silicone. Well, she's gonna bring a piece right now. She's gonna be practicing on silicone to test her needle depth, because a tattoo needle has to sink into the skin a certain amount of depth into the dermis layer. So that's what she's practicing now. And we use these little silicone pads to get her able to until she's doing
Judge
clean work on there,
people.
she's not going to be tattooing people.
Okay.
So you said that she's going to be tattooing friends?
She'll be tattooing friends when she's past this stage, when she's ready to start actually tattooing.
What happens if one of those friends decides to sue?
They will sign consent forms.
Absolutely, we have consent forms here.
And what are the
I-
terms of the consent form? That's
Yeah.
what I'm curious.
Yeah.
That's a,
Well, it's they acknowledge that they acknowledge the conditions that they're getting tattooed under. So if you're getting an apprentice tattoo, they know they're getting an apprentice tattoo. And when it comes to infections, it's usually due to the equipment, and like none of our equipment, that's not going to be an issue with us. I can guarantee that.
I don't know
We,
if you can actually guarantee that, because I have seen staph dermatitis from tattoos.
Not necessarily at your facility, but
No, no, yeah, no. this
I
is-
have kind of a two-part question. One, is this something that you are going to be approved tonight and then moving forward and or is this something that's going to have to get reworked, relooked at, and then voted on at the next meeting? So, want to answer that? No matter what we decide is decided.
and, you know, I thought we might be voting, but I actually think that because we have to go through these issues that the council raised, and they won't be, you know, written, we're not going to wordsmith it tonight.
Right.
I think we have to decide on these issues and maybe take it back to our next meeting, would be my feeling, unless someone feels differently.
no, I agree.
Because I'd just be curious to see what town council thinks of their consent form. I'd be curious to find out what the cost of insurance would be as an add-on to the business. I think those are things that you need to kind of look at and weigh, so you have a full scope of what it is you're gonna do with it, one way or the other.
Right.
So I'm
I
glad
agree.
if we're done voting on it tonight, that we can find that stuff out.
So, yeah, and I'm concerned about not making a requirement that might cost $1,500 a year. And, you know, and it would make it financially unfeasible to have an apprentice.
Right.
I think we probably need to know also, you know, a little bit of the lay of the land in other communities and what they've required. So it sounds like,
I could tell you that no other shop in this area is gonna have an additional insurance for the
apprentice.
apprentice. I can guarantee that. I mean, I've been doing this 10 years. I've been tattooing all over this place.
No one does
I'm
it.
not, I can guarantee that that's not gonna be a thing anywhere else.
Okay.
You think, do we have your email? Could we get a copy of that consent form so we could
Yeah,
show it to our town council?
We should, the city or the health should have the.
We have it.
Okay, great.
I'd be interested to know what some of the leaders, oh, sorry, Paula, I'm just,
That's okay.
yeah. What's, you know, I know there are a few communities that help develop the state regulations on body art. And I'd be interested to know what their practice is, just as a way of kind of reality checking us. So, and, you know, as you said, Rick, no, I don't want to impose something that would be prohibitive, but I also want us to make sure that, you know, we're tight on this.
Paula?
Point of clarification for myself. Is it Ryan I'm speaking to? I'm sorry. You have insurance for your business, correct? Do you have individual insurance for yourself?
I don't think so. I don't think I was required to get that. And
Okay,
I haven't had that in 10 years of being a practitioner.
Okay, just asking, I'm just coming from a different frame of reference, where
Absolutely.
the institution I work for has their insurance, and then I have individual insurance as well.
Mhm.
And when I am instructing students, they are covered under my insurance.
Right.
So that I'm just sort of trying to clarify it in my own head how it works.
I think, and I'm not sure, that if any of the guys were to get sued, it'd be covered under my insurance. I don't think they would need individual insurance.
Okay.
So I would ask Ade if you can, you know, do some research on these issues as we discussed in terms of the standards, particularly other leaders in the community that have done this, just to kind of confirm and maybe also ask town council around. You mentioned a liability. I don't see the Board of Health as being liable in a chain of suits for this kind of thing, but might be worth checking on that. On the second item, which is 1,800 hours enough as opposed to 2,400? I just don't have any personal context to be able to know what the right answer is. Last time we talked about this, I think a day you thought that 1,800 was fine, and I'm fine with that. Unless she didn't really, council really didn't, other than the fact that she's seen some other communities have 2,400 hours. She didn't really specify why. So unless people have strong feelings that we should go up to 2,400, I would probably stay at 1,800. The third issue she raised was breaking down the training hours between, sanitation, performing body arts, etc. Although theoretically, in my mind, this is attractive, I suspect that this apprenticeship is not breaking out experience in a curriculum that has didactic sessions on sanitation. It's kind of like you learn sanitation as you're learning to do the body art, and you're seeing what your supervisor or mentor does, or what have you. So I think from a practical point of view, it would be difficult to break it out specifically like that. So I don't particularly feel like we need to do that unless folks have other issues. The one thing I would add to this, which I mentioned in the last meeting and I didn't see in the draft, was an attestation that the apprentice has read section 23 of our health regulations regarding body art, because that's a pretty lengthy document. It covers sanitation issues. It covers all sorts of issues in the practice. It's really taken from the state guidelines, and I think at a minimum they ought to have read that and know that it's out there. Yes,
that was included, but it was taken out.
Okay, well, let's put it back in.
Mhm.
Go ahead, Paula.
I seem to remember reading somewhere that part of the requirements is that they have to do the online course on bloodborne pathogens. Am I correct, Carrie?
Mhm.
Yeah.
Yes,
So that would be one way of breaking things down.
great. Sorry, are you done, Paula?
Well, that was the only one I could think of, but I'm sure that there's more. The
Yes,
sharps
right.
disposal would be
Exactly.
another one.
But
Exactly.
those requirements of taking certain courses in bloodborne pathogens or anatomy or whatever, those are actually separate from the 1,800 hours. Those are pre-requirements before, I think it's before you begin your apprenticeship, which is the actual hands-on experience. So that,
With that, I would
so
say
that
that
one-
would be above and beyond the 1,800 and could be included and bring us closer to the
Oh.
2,400.
oh, interesting.
Right, right.
Courtney has done everything that a normal practitioner will be required to do. And when it comes to like cleaning and breaking down and all that, she's way past those hours. So we're just trying to get her to a point where we can set it up officially for her. Because she's like the hardest working girl I've ever met in my life. Promise you.
Yes.
Rick?
She's a
Carrie.
keeper.
Yeah, I mean, and that's great. And this is in no way, this is not a reflection on Courtney specifically. This is about us making sure that the town's regulations are appropriate for the next person and the person that comes in 10 years and so
Absolutely.
forth. Um,
And this is a first for us. So
right.
unfortunately, this is the growing pains.
Right. I think I would be interested I don't know if breaking out the hours is the right way to do it, but I think it would be appropriate to include some information about the specifics of the apprenticeship time. Because otherwise somebody could spend, not that you would, but I mean, it's the otherwise you could spend 1,800 hours working on that silicon pad that you
Absolutely.
just showed us.
Absolutely.
And say, I met the spirit, I met the rule, it said 1,800 hours. So to my mind, I think it would be appropriate to list out sort of the, time spent with working on recognizing you get through to the dermis and working on, what are the other appropriate elements. I agree, Rick. I don't know if if it's possible, I would be interested to know from the experts, if it's possible to break out the hours that you focus on a particular area in all instances. But I think it's important and worthwhile to kind of look into what specifically is being trained.
Okay.
And that be incorporated into the timesheets?
Right. That's, I don't want to make this hard. I just want to, right. Is that something you would do?
I could do it, no problem.
Yeah.
No problem.
Great.
That sounds reasonable.
Yeah.
So we need a breakdown of pretty much, so if it's 1,800 hours, you need a breakdown of what she's doing on a daily basis, like her agenda, or
Like so many 100 hours spent doing the silicone pad, so many 100
Absolutely.
hours doing,
absolutely. Now, does she need to have 1,800 hours specifically in one area, or is that just?
Oh, no.
No.
Okay. Yeah, I can write that out, no problem. And she hasn't hit that time yet, you know what I mean?
Right,
But I can definitely show you exactly what she's learning, what she's here.
Right.
Absolutely.
I think that's a good practice. And again, I'd be interested to know, if there are other communities. We don't want to make this complicated, but
No.
and
Yeah.
you could reach out too and see what other people are doing. So you're not reinventing the wheel.
So my mentor actually helped the health department in where's Tarn Shop in Tewksbury. So I don't think it won't be an issue. Whatever you guys need, we can get it done. Whatever I need to get Courtney licensed, I'll do whatever you guys need me to do.
So Ade, could you work to maybe identify several areas? I mean, the council mentioned one, sanitation, but several areas, and somehow incorporate it that there would need to be a substantial amount of time, of training and experience in those areas. And, maybe Ryan could help you with, a half a dozen different areas that are important, so that when you look at the timesheets at the end of the day, at the end of the 1,800 hours, there's substantial time. I don't think we want to necessarily list specific hundreds of hours of this or that, because I think it gets too detailed. But there probably needs to be some judgment there.
I'm not sure I understand what you're saying, Rick, because I think what Carrie and I were saying, that we do need to have some specification
Yes.
as to
yeah,
how much time is spent doing
Right.
particular tasks.
Right. So I think what I'm saying is, suppose we identify 4 or 5 or 6 specific areas, sanitation, needle disposal, certain elements that are part and parcel of this. The regulation could say, as part of the 1,800 hours, there needs to be significant amount of time focused on these, let's say, 6 areas. Then when the timesheets are done, the way we would structure the timesheets that need to be signed off by the supervisor, the timesheets could be constructed in a way that shows, you know, these hours were spent doing this, these hours were spent doing that, so that the health department could actually see that those areas were addressed over time. I'm just saying, not necessarily specify 115 hours doing this, you know, 212 hours doing that. I mean, I don't think we have the expertise, or that's what I was saying about micromanagement. But it would all be apparent on the timesheets that are signed, because that's part of the apprenticeship, that all the hours that the apprentice does have to be accounted for on these timesheets and signed off by the supervisor. Go ahead, Kevin.
I can see town council having a big problem with a unspecified number being put into a regulation, such as plenty of time spent, right? Like, so I completely get what you're saying, but it's going to cost them another month if we go town council and back and say, no, that's not going to fly. They're going to want something very specific in there if you're going to be specific about it. So you have to be kind of careful with this one.
Yeah, I get a sense that that's the case as well. I mean, with nursing students, you have to say so many hours were spent at, you know, at this particular task.
You could
You have
set
to be very
minimums.
specific.
I think a minimum idea might
Okay.
be, you know, a minimum of 100 hours doing this.
Ryan could probably help us with what those minimums should look like, really,
Right.
because he's the one who's going to be administering it. He wants a minimum of X, I'm sure, on different areas to start with anyway for his employees. So
That sounds right.
maybe
I
a
have
day
no
you could
problem.
work with Ryan to figure out, you know, the areas that
Absolutely.
he's going to be working with Courtney on, and what should it be a minimum for? I don't have the overall I guess it could be in the overall in the number, but that might be the easiest way to get what you're looking for.
Absolutely. I have a quick question. So if we do that and we get this taken care of in the next couple of weeks, would you be open to a meeting to vote on this so Courtney can get started as soon as possible?
Sure.
Sure. I think we could have a very brief meeting to review it. And, you know, if we get the revised document in advance, and we can seal the deal.
We're not going to leave you hanging, Courtney.
Can I ask a question in regards to that? Would we allow the business to count what Courtney has already done if they passed in all those time slips?
Even if you told us she needed 1 million hours, that would be fine.
Yeah, I'll do
Like,
I'll do them all.
She'll do whatever it takes. So even if we had to start from the beginning, we're not worried. We just want to make sure we can
Okay.
keep her. If
It may
keep
be a
her-
town council question anyways a day. They may not even let you do something like that, but I don't know.
That's right. The knowledge is still there.
All right.
Thank you guys. I appreciate it.
You're welcome.
And then the last issue that the council raised was, should there be a one-to-one relationship between the apprentice, the body art practitioner and the apprentice. And I guess the issue here is, you know, can Ryan supervise, you know, 5 different apprentices, and is that a safe situation and would provide adequate supervision, or should we limit it in the regs to one-on-one? Ryan, you have a
So every tattoo shop only takes 1 apprentice at a time. There won't be like
That's-
5 apprentices here. I know. Well, this tattoo shop's only taking 1 apprentice at a time, and we have no intention of taking anybody else.
Ryan, have you heard of something like that?
No, multiple apprentices. That's not real. That's not. Some people do it, but it might be 2 max. It won't be. It's very rare. It might. If a place is new, you'll see that. But if a place is established, usually not.
Some places allow a person.
So it sounds like then, if that's the case, putting something in there wouldn't be an issue,
No.
Exactly.
right?
so we can go with that. Sounds right.
So what would we say our max would be? 2? Yeah. It's fine. Based on feedback from a practitioner, I think that makes sense. Yeah.
Sure. Were there any other issues on this that we should raise? I mean, it sounds like what we're talking about is a day taking back this feedback to the council, doing some revisions to the draft, trying to get it to us in the next couple of weeks for, comments back to a day so that when we get the final draft in perhaps a 15-minute meeting, we can vote to approve it. So we can put closure on this. Does that sound okay, Ade?
Yes, that sounds good. Eventually, I'm going to be coming back to amend this same regulation to include microblading
Yes.
and some of body piercing regulations. So I'm just putting it out
With
there.
the same, with Ryan? Is that going through your shop? Okay, just clarifying.
I don't think Brian Courtney is doing microblading at the moment. You
No,
guys
we're
don't-
not doing no microblading, but piercing we will do eventually.
Correct.
But you want to bring so this is a thing you want to do a day to bring our regulations up to speed with what practice
Oh,
in the
Gotcha.
Correct. We actually have,
Got it.
we have,
Thank you for that.
you're welcome. We have an establishment right now practicing microblading
Oh,
in the town of Reading.
Huh.
They're not allowed to do it. They're doing it. So
okay.
Right.
Thanks, Ade.
So I think we're done on this topic. Ready to move on? Thank you, Brian, Courtney, for your feedback and
you.
help.
Thank you.
Thank you. Okay, Kevin, any updates on the coalition or?
No, they did not meet. It was prom night that it was scheduled for, and I think there was going to be hardly any attendance from the email I got from Erica. I will say, though, let's see, the new clinician, as I told you last time, is up and running really well. Tanya's got a lot of energy. They just posted a new press release is going to be going out where she's going to be doing some office hours. So kind of, pop-in time from Wednesday, June 15th from 9 to 10 a.m. at the Pleasant Street Center. And from Wednesdays, June 8th, 15th, 22nd, from 1 to 3 p.m. at the Reading Public Library. So I did get that today, so that'd be the only update I have.
So that would be for anybody who's interested in meeting with her, just socially or professionally or both? Did you hear me, Kevin?
Yeah, sorry, I'm just trying to pull it up real
Oh,
quick
okay.
if I can. Okay. Yeah, I still haven't done that. Sorry, folks, I got to do that with my my computer here. So let me read it.
You're muted.
Sorry, my space bar wasn't working. It's written as she can assist residents with brief therapeutic support and assessing resources
Okay.
with them as well. So it's pretty much open for anybody to go in that just needs to look in to see about what resources they can are out there for them and discuss if it's them or maybe a family member that needs some support.
Oh, that's great.
Yeah, so it's good. They can pop in
Yeah.
sessions.
All right.
I have a question. Kevin, maybe the next time you meet with the coalition, I'd be interested to know if Erica and other folks are attuned to the roadmap for community behavioral health. There's an open procurement right now for establishment of community behavioral health centers. It should be awarded sometime this summer. And there's an ambitious timeline to have these kinds of things up and running in January of 2023. Broadly, it's a way to try and address some gaps in need through provision of services instead of a medical community health center. It would be a community behavioral health center. And I'm just starting to learn a little bit more about these, and I'm really interested to know how the coalition, if they get an opportunity to weigh in on this and how they might access it, or
It's called a roadmap for behavioral health.
yeah, if you can Google, if you do roadmap for behavioral health on mass.gov, there's all the goodies. And the last presentation is from April of 2021, but they are currently in procurement for starting to get these programs moving. And I was thrilled to hear about it, and thought of the coalition and you as their liaison. I'm really interested to see how if they have any input on it, if they have thoughts about it, if they want input or the like.
Okay, yeah, I'll talk with Erica next week, just so I can put it on her radar to, if they're not, so she can look into it and get an update for you. That's easy enough.
Yeah, thank you, Kevin.
Yeah, thank you.
A day, the monthly report.
All right. The month of May was very busy for us. So I would go over the inspections, and then I think Christine is here. She would give us some updates about COVID, and then I would give updates about everything else that's happening within the department. So in the month of May, we conducted 35 food inspections, thanks to the new software that we just procured. It's been really helpful. It makes inspections easy for us. So, that has been a good addition to our department, good procurement. We conducted 1 food reinspection, 3 housing complaint inspections, 3 swimming pool inspections, 2 swimming pool re-inspections. We also issued 3 new permits, 1 for a new food establishment, half and half, and 1 for a residential kitchen, and 1 for an ice cream truck. We issued 3 temporary food event permits, 1 for the Reading Lions Club, 1 for a street party, and 1 for an ice cream social. There was 1 closing / changing ownership. Biltmore and Main closed, and Public Kitchen is taking over. So we're waiting for them to turn in their application, their food plan review application, and we'll work with them to get them licensed. I will now pass it on to Christine to give us updates about COVID-19 and other communicable diseases within the town of Reading.
Hi, good evening,
Oh,
everyone.
I had a question before we start.
Hello.
Kristen, hi. Go ahead, Paula.
I had a question, Ade. The housing complaints. Could you be a little more specific about them?
I would let Jen talk about those, please.
So the housing complaints, one of them was a neighbor complaining about their other neighbor's yard waste. There was no violation there. The other 2 housing complaints, one was the trash room in the condo complex overfull, but we're working with the planner and the builder to try to figure all that out, and the planning team, because they want to put a dumpster outside. And the other one was a young lady had a leak in her apartment that she was renting, called me because she hadn't heard from the landlord, but by the time I had gotten there, within minutes, landlord was already there and fixing and replacing.
Good.
Thank you. I appreciate that.
You're welcome.
Because you see the housing complaints and you have no idea. So I appreciate this, the clarity.
Thank
Can
you.
I also ask one question? At the select board meeting earlier this week, Mark had raised the issue of noise complaints, but I only
True.
saw one noise complaint. So is this something that is active, or is there a lot of them, or?
I have received one noise complaint, but they were advised to call the police. It was their neighbor was being loud early in the morning or late at night, and then they had called the police. That was the only noise complaint I have gotten through our office.
Oh, okay.
We also have a noise complaint from the Verizon building, and we are working with Verizon to turn in an application and a plan to redesign their HVAC system and pretty much enclose it to reduce the noise coming out from their system. So we had a meeting with them, I think 2 or 3 weeks ago, and they gave us a timeline, but I wasn't too happy with the timeline. They were talking about a year because of the supply chain issues that we're having currently. But and then we were looking for 50 decibels as the threshold, but the plan they gave us was over 50. So we didn't think it met the state requirement. So we pretty much told them to redo their plans and resubmit the plans. So hopefully, I don't think that issue will get resolved this summer, but it will get resolved.
Thank you.
Thank you.
Thank you.
Sorry, Kristen, to interrupt you.
Oh, that's okay. Thank you. So this is a weekly nurse report, and dated 5/26 to today 6/2. And the data provided is obtained from Maven and is subject to change. The COVID cases data does not include any self-reported or non-medically monitored test results. The total case count is 5,202. And I just wanted to mention that the total number doesn't include any repeat or reinfections for individuals that may have had COVID more than once. The current active caseload is 44, so that is down from last week. Deaths remain at 53, transferred cases at 17, and recovered 5,088. With regards to other communicable diseases, there were 4 influenza A cases over the past 7 days, and there is 1 salmonella case that was reported this morning. The investigation is ongoing, and it was not a Reading food establishment or food worker. And I can certainly provide any updates, as the investigation continues. There are no clusters to report, no daycares, businesses, or recreational clusters. I did include slides that Mary Juliana, head nurse at Reading Memorial High School, submits to DESE weekly. And per her meeting with her, she has reported that the overall number of cases at school are also down. She wanted to let me know that DESE will no longer be funding testing programs. And I believe that's going to be next week. And they're encouraging that masks be worn at graduation and any indoor group activities, just encouraging. We have a bunch of upcoming clinics scheduled in collaboration with Mary and Vaccinate RX. Friday, June 3rd from 2 to 4 at Coolidge. Friday, June 17th from 2 to 4 at Coolidge. Wednesday, July 13th, 1 to 3 at Killam. Thursday, August 11th, 1 to 3, Killam, and Thursday, the 25th, 1 to 3. I wrote location to be announced. I do believe that's going to be Killam as well. And these dates are posted on the website or will be updated. I think I'll let Ade discuss the camp inspections. The health department did meet to discuss, reviewing the binder of the policy and procedures that they submit. So those will all be reviewed before we go in for inspection. Some blood pressure clinics will be scheduled over the summer, and that will dates to be announced. Influenza vaccine has been ordered for fall 22-23, and I will be returning any remaining vaccine from last year that was unused per protocol to the Department of Public Health. It has to be done by July, but I'll probably send it out at the beginning of next week, and we'll provide an update on any refund for that. And unfortunately, I was sick last week, so the vice chair for 3B did step in to chair the meeting, but I am going to be attending an upcoming event. I believe, let me see, it's June 23rd. The region is going to be working as a group to develop a hazard vulnerability assessment. And this is going to be held at Northern Essex Community College from 1 to 3:30. So they have some training, education, planning resources, and I can certainly provide an update, excuse me, following that event. Thank you.
Paula?
Question, Christine, just a point of clarification. The clinics that are going to be held at all the schools are for anyone of approved age, whether it's their first, second, third vaccine, correct?
Correct.
Thank you.
Carrie?
Christine, I hope you're feeling better. I'm glad to hear
Thank
you're
you.
going to the HVA event. Do you know if the results from that hazard vulnerability assessment process will be made available, and is something that you can bring back to share with the board?
You know what? I do not know, but I absolutely will find out, and I can probably find out before that meeting. So yes, I will definitely get back to you on that.
That would be great. The HVA process is a really interesting one and helpful for everyone to see. I would expect you'd be able to, but I don't know. I mean, it's not my region, so I don't know how they work. But I'd be very interested in seeing the results and hearing about your experience. I think it would be very helpful. Thank you for representing us in that work. It's really important.
It is, and I'm new at it, but I have to say that everyone from local to state level that I've met so far, and they've been extremely helpful.
Yeah. Good. I'm glad. And I appreciate that you have stepped up into that. It's good work.
Yeah. Thank you.
Not that I'm biased. All right, maybe a little biased.
Thank you, Christine.
Sure.
All right, moving along. In terms of vacancies within the department, we still have a full-time public health nurse vacancy. We did a few interviews, and we decided that we will be reposting the vacancy next week. I had a meeting with HR today. We also plan to post the admin assistant position vacancy on Tuesday. Reading Friends and Family coming up June 11th from 10:30 to 3 p.m. We're registered to participate, and we plan on using this opportunity to connect with Reading families and share vital public health information. Let's see. In terms of the well-being of the department, things are moving along. Things are going well. No major issues so far. Let's see. We received a public health grant from the state in the amount of $19,642. I brought this up at the last meeting, and hopefully we can have a discussion about how to expend the funds tonight. I reached out to MHOA to get a feel of what other communities have been spending the funds on. And pretty much the response I got was anything related to COVID. Even if we spent money on COVID earlier in the year and we didn't get reimbursed for it, we can use the funds for that. So
Really? Wow.
yes.
That's great.
Very nice.
So they'll reimburse COVID-related expenses that were not reimbursed by MEMA or FEMA or
Correct.
other COVID grants. Okay.
Yes. So if we can have a quick discussion about what to use the money for, I mean, that would be great.
So what have you not been reimbursed for?
So that's a question so Chief Burns, I know, does a fabulous job of documenting what all the expenses are. You know, it's a full-time job in part. So he would probably be a great resource in terms of identifying what the negative space is. I have some ideas, and I apologize, I didn't send them to you a day.
That's
Too many
fine.
things happening, but I do have some ideas if I can share them with you now.
Absolutely.
Okay. And I did reach out to some esteemed colleagues who are smarter than me. They helped me with this. And there was a suggestion about whether we might want to look into purchase of MERV 13 filters. You know, although work on the filtration that was done for school buildings and office buildings and the like, that might be something that we can purchase and have on hand for future needs. And CO2 monitors. It might be a useful tool, again, in the schools in terms of, or other buildings in terms of air monitoring for quality and whether you need further portable HEPA filters.
Yeah.
And the indicator where you could use the data from the CO2 monitors to help prioritize where you might need the HEPA filters. And it wouldn't be just for schools. It could be for any public meetings, right? I mean, it's you know, is this room a great room for it, or do we need some filters or the like? So I thought that was pretty great.
If we return to in-person meetings, maybe we can put one in.
Right. Right. And then, of course, there's, you know, I didn't know if there was a need for technology, if there's an additional need for laptops or tablets. I know those were in high demand with running for the EDS sites. I know that we have some external relationships, but I also know that the state requires use of their system where you really do need a tablet. So if we're doing a flu clinic, for example, they were valuable. Or if you discovered that there is a need for a phone or phone and data plan for a staff member who's not already covered by phone, who would be willing if they have a 24/7 contact and the town's not already covering that. Signage for test, you know, I mean, it's like any kind of sign, because you can put for test kit availability, you can put it for vaccination clinics, you can use it, you know, if we wanted to communicate anything else, maybe if they could be used at school buildings or in front of town hall or the like. And I think that was, there was one other suggestion of whether, we wanted to buy some tech time to have somebody do some setup for voluntary reporting of test results. I guess some other school systems have done that. And if you find a smart person who can set up a little form, then you provide the link on the website if it was of interest to people. I know dashboards, those kinds of things were a big interest. It might not be as important now, but those are my ideas.
I think you spent all the money, Carrie.
You have no money left.
only if they're useful things, but I mean, I thought they were pretty.
Yeah, no, great ideas.
Yeah. Thanks to
Great
my
ideas.
smart,
Yeah, a lot of
thanks to
great
my
ideas.
smart friends.
The signboards alone, I think, are a great idea.
Right. I mean, yeah. I thought that was, that has some good flexibility. I don't know. Like, because you could put one of those sandwich boards maybe on the steps of town hall or at the senior center before folks come in, if it's portable or.
I was even thinking
Oh.
more of the big electronic ones.
The
Oh.
smart boards, right?
Oh. Right.
Yeah, but those are seasonal though, aren't they? Don't they come in for the winter? I mean, I'm not saying you couldn't do it, but
That
that's
has been, that was one barrier to use.
Yeah.
That has been raised as a no, we can't put those out because it's seasonal. I might be worth revisiting with Incident Command a day.
I was thinking more of procuring a smart board because it has a lot of uses.
Mhm.
Eventually, we plan on teaching food safety courses at the health
Yes.
department, and it'll be a good resource for us.
Oh, interesting.
that is a good idea too.
Would it be located in maybe in the ultimately it could be located in that new training room?
Correct.
So it would be available for use for
Absolutely.
nursing staff reviewing
Everything.
reports and the like. Good.
Yeah, looking at data, graphs.
Yep.
Things like that.
Great ideas.
Very good. Ade, have you, has this been discussed at Incident Command? Because it seems like they would have a good idea. I mean, as Carrie said, Chief Burns, but in general, that group.
Yeah, I will bring it up at the next meeting. We haven't specifically discussed the funding, but I'll bring it up.
Great. Sure, if there are any other ideas, people should just send them along to Ade.
Yes.
Sounds good to me. If we don't use it, we have to give it back. I don't wanna do that.
No.
It's surprisingly hard to spend money fast. It's although not surprising, I would say it's good. We don't want government money to be able to move really, really fast. We want it to, be thoughtfully spent. So,
Absolutely.
that's great.
Okay.
It's more smart board is a great idea.
So we should move on to public comment.
I'm sorry.
Go ahead.
I didn't know where I just had, well, I thought I had two, but now I can only remember one. I forgot to mention at our last meeting that I attended the Mass Association of Health Boards annual training session that was held out in Marlborough on May 12th, I think it was. It was a full day of training. It was really well done. It was very interesting. I did not sign us up for the $100 handbook that you can access online, but I know it's available if we wanted to have a physical copy. I think one of the things that was, one of the things that I took from it is that the state is moving forward on helping communities with their shared service applications, and also with the implementation of workforce standards to help kind of guide how you make decisions about hiring and about what board members and staff members ought to by right be trained in, which I thought was great. I thought it was really great information. It's a thoughtful process. So I recommend the experience if anybody has the time, and I'm happy to talk about it more if anybody wants to hear. So, and I guess that was my other thing was I had a question about the shared services application and whether you had heard anything.
I haven't heard anything back. Once I do, I'll let the board know.
I figured, but wanted to inquire. Thank you. Thank you, Rick. Sorry, I
Sure,
didn't
that's
try to insert myself.
In terms of public comment, I see one person from the public, Narcissa. I don't know if you would like to make a comment at all.
First, I did have a question. What is incident command?
So Incident Command is it's a management team that was put together a year and a half, 2 years ago to address the COVID issues in the town. And it's chaired by Chief Burns, the fire chief, and has the police chief and the health director and the town manager and assistant manager and several other people. And they meeting quite frequently in 2020, but I think the meetings now are much less frequent. But it's a coordination committee to coordinate the COVID efforts.
Yeah, one would think those should be almost dissolved, but okay, thank you. So I think most of you know why I'm here. I sent a letter before the last Board of Health meeting that went over in part what I brought up 3 meetings ago, and I thought we had some agreement that it was important as far as transparency. When you're promoting the vaccine all over the place, you need to make sure people can make a smart decision for themselves and for their families. And that includes certainly where you're providing the actual vaccine, things like links to VAERS, links to respective companies that are manufacturing this stuff. And whereas I think informed consent is always important, right now, they're all at EUA, which means if any of those adverse effects occur, which are globally, nobody has any recourse. The companies aren't liable and people get nothing, no form of compensation. So I think it's vital that people who are considering it have that information. And honestly, on the site itself, on the Reading Board of Health site, why not, especially with some of this newfound money, do a little research if you don't know it already of the means of preventing, so people can, first of all, maybe not get it. And if they do, it really minimizes symptoms, because that's exactly what some of just natural vitamins and exercise do. And I think it would behoove also the people who you're representing to understand some of the cures that are out there, because it concerns me. And thank you, Kevin, for sending the soul letter that I got, that there's too much reliance on the CDC. And while I understand that's a source, they're not known for constant accuracy. And I think it's important to find several sources, especially now that so much is known after 2 years of this illness. So I want to know how you're going to move forward with that. I was sort of, I guess, expecting that to be covered last week, given how long it's been on the agenda, but I'm open to thoughts on it.
Okay, thank you for your comment. And, I think that from my perspective, I think there are links on on the website that link to mass.gov, to CDC, and so forth. And obviously, when one takes any of these vaccines, there's a consent form that lists adverse effects. So there is information out there. I don't think that and I'm open to hearing from other board members. I don't think it's our obligation to provide an encyclopedic set of references around this. I think we have an advocacy role around promoting the vaccine, testing, treatments that have been proven and that are widely recommended. Doesn't prevent residents from going to other websites elsewhere if they want to seek more information. I suppose we could always put more links on our website, but again, it's the website is not the sole sort of source of information. It's a source that represents, I think, what this board feels is important. Again, vaccination, treatment, and testing. And you may have noticed that there's been a change in the website a month or two ago, where what's happening is that the board's website, you go to the Board of Health, it's fairly minimal. It lists, members and meetings and agendas and minutes and so forth. But there's a health department website that is much more extensive and does have COVID information. So if you've just been looking at the Board of Health website, you may be missing some of it. You should look at the health department website, go to the yellow COVID section. If you scroll down under the dashboard, there are links to more information. So that's my sense of things. I don't know if other board members have other comments. Carrie?
I just would caution against us engaging in adding multiple links. I don't think we have the staff time to do. I'm not sure that our staff are actually the folks that I would ask be doing research and hunting down and verifying the validity of the different sites that are out there. There are an awful lot of sites out there, and it's hard to discern what is accurate information, what is not. And anything that we chose to post, we would be putting some degree of what am I trying to say? We would be using our authority to say this is a source that you ought to be considering. I would be reluctant to do that. I will call out specifically, again, VAERS as a resource that I would not include for any of our communicable diseases, because VAERS does not provide information about adverse outcomes. It provides information about potential adverse outcomes so that folks may investigate and determine whether or not the incidents that have occurred, whether the incidents are vaccine related or not. There are a lot of limitations to VAERS. And if you speak with anyone who does work in the field, they'll tell you VAERS is not a place it's a place where you can gather a lot more misinformation. It's a great resource for people to go hunt down and then interview the folks who choose to complete all of the information in the form, and be able to do the essentially case investigation, just like Christine does for a case of salmonella and the like. But many people don't actually provide all of that information, and it has to be verified before it actually can be called an adverse outcome. So I want to particularly just caution away from theirs, but I don't think that we ought to be doing it. And I know we don't do it for all of our communicable diseases, and I certainly wouldn't want to do something for one and sort of elevate that for one, and not be taking on chickenpox or flu or the like. I think there are other great resources out there that people can rely on. The local health department isn't really the place that we ought to, that would be the one to provide all the links. I think it's great that you want the information, but that's not within our purview.
Paula, you have a comment?
Just, I would suggest that if there is concern about anything like this with regard to any immunization, not just the COVID one, that those are the kinds of questions or concerns that should be brought to your primary care provider.
Mm. Right.
Yeah, I think, Narcissa, like I wrote you earlier, to me, one way or the other doesn't matter, but where informed consent is happening at the point of vaccination, I really don't see a need for it on the Board of Health level, especially as things change. That's the thing that we have to try to keep up with. And it's not sustainable for us to do so. On that level, there are many other professionals out there that as Paula mentioned, your primary care physician being primary one of that are much more versed in keeping up with what is current, right? So that'd be very difficult for staff to do. And again, like I said, the informed consent happens at the point of vaccination. I'm fine with that. We are going to be doing a community needs assessment coming up here as well. And that's going to encompass a whole lot of the health and well-being of the residents and staff in town. So, it's definitely certainly a topic of discussion for that as well, when you're talking about other means of protection. And I don't know what those are or what reports are out there that are verified and that are good to follow, but we can also try to find that out too during that time period.
Can I go?
Okay, thank you.
Can I just add something, please?
Yes, just to wrap up, go ahead.
Yeah, I merely suggested VAERS is because they're related to the CDC, and I know that's lore for some. I actually believe that they're underreported. So I'm not saying they're necessarily accurate, but something. If you're not qualified or don't have the resources to list everything, then why promote so heavily the vaccine on the site? Because that's not necessarily well-being. Providing well-being for the residents is providing them as much information as possible and not being slanted to testing and vaccine. And I'm not saying that what I presented was the solution, but something else should be there, and not just, because that's what people rely on. There are people that don't know to look at links on another page. They're going to go to the main page. And so there's a certain responsibility with providing a given amount of information right there. That's all I'm saying.
Okay, well, thank you for your feedback. So I think our next meeting is July 7th. And we will have an update on the MAPC set of recommendations and where that's going. We may have a short meeting, as we talked about, sometime in mid-June to finish up on the policy on the apprenticeship. And, I thought the select board meeting went well with respect to, expanding the membership to 5 members. I think they're pretty much on board, and hopefully we will get it in to the town meeting this fall so it can go to the state legislature for approval at some point in the next 6 to 12 months. Any other concluding thoughts at all, or other things we ought to have on the agenda, or yes, no? Nope. All right. I would make a motion to adjourn. I have a second.
Second.
Roll call. Paula?
Yes.
Carrie?
Yes.
Rick? Yes.
Go Celtics.
All right, go Celtics.
Everybody.
Good weekend.
Everybody.
Bye, everybody.
All right.
Bye-bye.
Bye.
Thanks all.